I'm Stacey McNeilly.
And I'm Joanne. So, just so you don't get us confused. So we're going to talk about Alpha-1 and respiratory rehab. So, first symptoms, you've had lots of experts already explaining this disease. You guys live with this, you know the symptoms. But the things that we see first is the shortness of breath, the decreased activity, and then the loss of endurance. And everything we're looking now in respiratory is quality of life. And a lot of our things have shifted. I know lots of the talks before focused on FEV1 and things like that. We're all kind of looking at quality of life. Oh. We're looking more at quality of life. And so for us, these are the big things: the shortness of breath, the activity, and your physical endurance. So the good news, all these three things can be treated well once you go to respiratory rehab. So what we're going to look at is the shortness of breath. Shortness of breath is debilitating. BC Lung's old motto used to be that when you can't breathe, nothing else matters, and it's true. It's our fight or flight that comes in. When you can't catch your breath, nothing else matters. And we see this day in, day out with the clients that we deal with every single day. So that's going to be our marker. How do we decrease that and improve quality of life? Once we deal with that shortness of breath, a lot of things just fall into place. So this is the negative cycle we want to halt, and respiratory rehab is the perfect way to do that. Once we get short of breath, that anxiety, that panic kicks in, then we do less, because nobody likes to feel short of breath and feel that way. When we do less, we lose more muscle mass, then that gives us the ability. We have increased fatigue. This cycle is a negative feedback because the cycle just deteriorates. And we see that people who were active, that shortness of breath and that fatigue, once it starts setting in, then their existence means from bed to bathroom or bed to kitchen. And again, we need to halt this, and exercise is the way to do that. So the benefits, we'll start at the top. Reduce shortness of breath. We'll give you tools in your toolkit. I'm going to talk about a few simple tools today to have in your toolkit. You might wake up one day and you know what? I feel good. I don't need any tools today. There might be another day I'm not going to have a good day, and I'm going to need to enlist like 5 or 6 tools or 7 or 8 tools just to get through the day. Every day is a surprise. You guys know this better than we do. So reduce the shortness of breath. Improve limb function. Not only is rehab about aerobic exercise, it's about strengthening, it's about stretching, it's about making sure that our limbs stay strong. Then also increasing your exercise capacity. So you're walking further distances, you're doing more, you're being pushed. And at some cases, there's no benefit to not pushing yourself. So again, we're saying you have to work a little bit harder. If you're standing next to me, having an entirely full conversation with me, you're actually not working hard enough. So we're going to push you a little bit with that. Again, too, when you're feeling better, you don't have that panic or that shortness of breath sensation, then your emotional status is much improved. Again, all adding to that improved quality of life, which is the hallmark for what we do as respiratory therapists. We want to improve people's quality of life. And the other side of rehab is the knowledge. So there's education that goes along with that. Knowledge is power. The more you know, kind of like many of the talks today has already said that the more you know, be your own expert. Know your disease better, because you're probably going to know it better than 99% of the people you come across. So in the end, that all those things add up to improve self-efficacy. There's a psychologist, Dr. Bandura, said, self-efficacy is one's belief in one's ability to succeed in any situation. And that's what we want our clients. We saw lots of data before, too, about self-efficacy and self-management. And once you become the boss of your disease, you get with the knowledge and all the other experts help out there. Once you become the master of it, you're self-efficient, and that way nothing can stop you from that point. So, some practical tips. When you're exercising, that shortness of breath is the key factor that sends us into that spiral. We don't want to go down that spiral route. So again, make sure you're taking your medication. Adherence, we talked about the lungs being really inflated in a couple of the other talks. You want to make sure that you're taking the bronchodilators, you're taking what the doctor said. If you don't like the device or the type, or you find it hard, There's a billion of them out on the market now. Maybe not a billion, but there's a lot since I started 26 years ago. So there's different medications, there's different types. If one doesn't work, go back to your doctor. Again, advocating for yourself. always carry your blue inhaler with you. It will rescue you. Use mobility aids. I know when I see some of my clients are really struggling to walk, I'll tell them, I'm like, we should get a walker. And oh my goodness, it's like I've said something totally horrible to them all. And then I said, okay, we'll do this before the next time I come back. I'm like, next time you go grocery shopping, go get a shopping cart. And they're like, oh no, I just leaned over the shopping cart and I could walk like the whole store. I did Costco. And I'm like, that's the same thing. What you want to make sure is that slight lean. There's little tips that you can do. That slight lean, like with a walker or grocery or shopping cart, it helps your diaphragm work better. Again, these little things make a big difference in the quality of life and what you can do. Take rests. If you're really tired, we don't care how long it gets you to somewhere. I have one of my favorite clients, I'll talk about him in a positioning thing later, but his goal was to make it to the mailbox. So practiced in his house, practiced down his stairs, practiced in his front little porch and stuff. And he finally got to the mailbox and back. And he's like, but Joanne, it took me an hour. I'm like, I don't really care. I just want you to get out. I want you to be doing it. You're goal setting, you're achieving your goals. It doesn't really matter how much time. And really, we've got time. And practice your breathing techniques, which we're going to go over right now. So, pursed lip breathing. Again, the basis of this with the emphysema is that you have too much air in your lungs. So your breathing techniques are going to be key to that. So you want to make sure pursed lip breathing just uses the basis of physics. If you inhale through small orifice in your nose, it entrains more air and actually gets to the bottom of your lungs. So you want to always be breathing through our nose. It provides heat, it provides humidity. Our lungs are happy, it loves warm, moist air. So always be breathing in through our nose. Get the air to the bottom of our lungs. And then when you're blowing out, you're going to blow out through pursed lips, like it's like a little shrink the space that you're doing. Perfect technique back there in the white coat. And so you're breathing in through your nose, blowing out through the pursed lips. And what that's doing is actually splinting open the airways so you get the air out. So with this disease, with emphysema, you want to try and always be getting the air out. So you're focusing on exhaling. Again, it's kind of a mind flip when you think about shortness of breath, because shortness of breath has you gasping, I can't catch my breath, I can't catch my breath. But the reality is they have too much air in your lungs. The problem is you have to get it out. So everything we're talking about is really focusing on exhaling out the air. So most of these pictures too, just by the way, are living well with COPD, the pictures and stuff. So I have some color booklets, and we'll put them out with the BC Lung thing in a couple minutes when we're done. Oh, backwards. Sorry, got too excited. So walking again. Inhaling for 2, exhaling for 4. Again, always focusing on getting the air out. You want to remember to exhale on exertion too. So if a lot of people always tell me when I'm talking to them, they're like, I can't tie my shoes, I'm so short of breath, and that just does me in. I do up my shoes, I'm gasping for air, what's the point of going out? Well, there's lots of points of getting out, so let's talk about why you're so short of breath. And if you notice those times when you're short of breath, to actually kind of think about it, and what we've noticed a lot of the time is people hold their breath. Hold their breath, really get the job done, tie my shoes quickly, and then, I'm so short of breath. So you want to always remember to exhale on exertion. So if you're bending over to pick up anything or tie your shoes, and do that. Exhale on exertion. If you're a heavy weight lifter, those guys that lift their 5,000 pounds above their heads, they'll make those big loud noises and stuff. You don't have to be that dramatic. But still, the same idea is you want to remember to always exhale on exertion. And these little tips, just stick them in your pocket. Because one day, you think, that's all I need, and then I'm good to go for the day, or I'm a little short of breath. Oh yeah, I just realized I was holding my breath. So, pursed lip breathing with stairs. Stairs tends to be a really big restriction for a lot of people. So again, keeping that motto that really, I don't care how much time it takes you to get up the stairs, you should be doing the stairs because they're good exercise. So again, if you have to inhale before you start, go up a couple stairs, exhaling, then stop, and then inhale again, and then up another couple stairs. If you're feeling not that short of breath when you're doing stairs, then you can inhale on a couple stairs, and then blow out, but always making sure that your exhalation is always longer than your inhalation to get rid of that air. So, We talked about the lungs being hyperinflated. There's the stuck air. What we normally use to breathe is our diaphragm. When you have the emphysematous part of that, we tend to use all our muscles. We use our neck muscles, we use our upper chest muscles, we use our back muscles. This is all really tight because we're working hard to breathe. What we need to do is we need to recruit our diaphragm a bit more. Our diaphragm causes very little energy expenditure to use. It doesn't take much energy to breathe that way. And it's kind of opposite to how we think to breathe. But if we can recruit our diaphragm a bit more, make it a bit more efficient, our breathing creates less energy. So with diaphragmatic breathing, you're going to put one hand on your belly and one hand on our chest. Now we tend not to want our belly to go out when we breathe, and we all suck it in, especially as women. We suck everything in. But what happens when you're belly breathing is you want to actually, when you breathe in, my belly goes out. When I breathe out, my belly goes in. It's surprising how much practice it actually takes to do abdominal or belly breathing. An easier way we find to teach people is actually when you're lying on your bed on your back. So if you're lying flat, you put one hand on your chest, one on your belly, and really focus when you breathe in. Your belly goes out. When you exhale, your belly comes in. And using that again, it's just a more efficient way. The goal is to always save energy, and we want to save our energy for the things that are fun. Working about spending all our energy on breathing, it's a lot of work, and there's a lot more fun things we can be doing. So again, little tips. If you're going somewhere further, maybe start using your diaphragmatic breathing. So body positioning. So again, that diaphragm is a very efficient muscle. It's two muscles, each a hemidiaphragm, but it's a very efficient muscle to breathe. It contracts, sucks air in, relaxes. With the emphysema, it doesn't have a lot of space to move. So even just a slight lean forward makes a huge difference in how efficient it is. The guy in the top or in the bottom left there, I quite often will go to people's houses. I see people in their homes too. And when I go into their house, I'll come up the stairs and they'll be like all hunched over like this, leaning over. And I'll be like, do you know why you're sitting like that? And they're like, it's the only way I'm comfortable, Joanne. I have no idea why. And I'm like, it's because when you lean forward, it takes your belly, it takes your chest, it takes all that weight, a little bit of that weight off your diaphragm, and your diaphragm can actually move. And the minute your elbows are on something, it's kind of splinting it again to help open up your chest a little bit. And sometimes all these little things are all it takes to make you feel better. And again, when you feel better, there's less shortness of breath. Again, your quality of life is improving. So the top guy is just sitting, the bottom guy is my leaning over guy. The top standing guy on the left, that's your using a walker. That's or the shopping cart, whatever you want to do. Go to Costco, grab a cart. Excellent place to shop. And your reward, if you go down enough aisles, is you get little snacks as a treat. There's always ladies giving snacks. So there's my bottom guy, position B. So I kind of talked about this position Bob, my guy who wanted to make it to the mailbox. Again, that was him at the mailbox every day. Every day at least one person stopped. Are you okay? Are you okay? He's like, nope, just gathering my breath. And that's what he had to do. But he achieved his goal. He was getting out and again, improved his quality of life. And that's what it's all about. So we've seen this slide before, the guidelines of COPD. Just integrated care is the basis of all the foundation in treatment. It's before drugs, it's before everything else. Smoking cessation, exercise, getting yourself some support, that's the key of it all. And that's what respiratory rehab, where respiratory rehab falls. And now there's Stacey.
And I get to talk about respiratory rehab. Throw on the right slide. Yeah, I'm short.
He's a little short.
So respiratory rehab is defined by the American Thoracic Society and the European Respiratory Society as a comprehensive intervention based on a thorough patient assessment followed by patient-tailored therapies that include, but are not limited to, exercise training, education, and behavior change, designed to improve the physical and psychological condition of people living with chronic respiratory disease and to promote the long-term adherence to health-enforcing behaviors. It's quite long, so we'll talk about it. Respiratory rehab is generally geared towards folks with moderate to severe lung disease, although it's important for anybody with any lung disease to have exercise regime. I'm just going to fix this computer. There we go. The key components of any rehab program, we look at patient education and self-management portions, structured exercise parts of it, which include aerobic, weight training, and stretching, assessment and outcome measures, and a plan of an ongoing exercise program for continued exercise after. The goal of any respiratory rehab program is to improve the physical and psychological condition, promote the long-term adherence to healthy behaviors, and the overall improve and maintain quality of life. There's several considerations to starting any rehab program. You have to discuss with your physician whether or not rehab is suitable for you. All programs have different entrance criteria. Some require a respirologist referral, some just a general practitioner. You may need recent lung function testing. Some ask for a cardiac stress test within 6 months to a year, and depending if there's a rehab program even close to you available. Education. Here we go. So the different education classes, typically rehab programs at least 1 hour per week of education. Topics include, but not limited to, living with lung disease, understanding lung disease, and the program that I coordinate, I go through all the different lung diseases, alpha antitrypsin, fibrosis, you name it. We talk about controlled breathing techniques like Joanne went through, recognizing and managing lung irritants and infections, medications. I often have the patients bring in their baggie of medications a couple times throughout my 10-week program, just to review how they take them, any questions. And even after going through it the first time, the second time, there's usually still questions. It's ongoing. We talk about oxygen. Supplemental oxygen, I see there's a few people here on oxygen, for people whose oxygen levels are low. In rehab, we monitor oxygen levels very closely using a portable saturation machine. Oxygen may help to relieve some shortness of breath and may help endurance if blood oxygen levels are low. It's best to talk to your physician or respiratory therapist to see if what your need is and to find out what the funding is for your province. We talk about exercise, of course, in the education portion. Nutrition, I often bring in a nutritionist to talk about nutrition. Airway clearance, recognizing and managing stress, and smoking. Smoking is the big one. We're lucky I do the tobacco education, so I provide smoking cessation education and support ongoing. Self-management. Self-management is understanding what is happening to you and your body. Knowing what you can do to help yourself and what supports are available. Who can you turn to? Disease pathology. Understanding what alpha antitrypsin deficiency is. How is it different from other lung diseases? Disease trajectory. What's a typical course of this disease? Avoidance of triggers. Knowing what your triggers are for your breathing. It could be colds, flus, being tired, run down. Environmental is a big one. The wildfire smoke this past summer affected lots of patients. Weather changes. Explanation of a flare-up and prevention of flare-ups. It is recommended, and it was mentioned in a previous presentation, about having an action plan. And your doctor or healthcare provider can help you develop one. An action plan will tell you what to do if you have a flare-up. It's also called a lung attack, an exacerbation. Action plans help you recognize and treat your flare-up so you can return to normal as soon as possible. And we use the Doctors of BC COPD flare-up action plan. I know Joanne in the community, they also use this one. There's all sorts out there. But typically they use the stoplight approach. So the green, yellow, and red. So in the green zone, your breathing is what normal is for you. Your normal shortness of breath, your normal cough, your normal mucus, what color it is normal for you. And you're taking your daily medications, whatever that may be, whatever puffer, whatever cocktail you're on. And then you have a change in symptoms. You may have more shortness of breath, more coughing, more mucus, change in consistency, change in color of your mucus. What do? It often happens Friday night. You can't get into your doctor till 2 weeks, right? You don't want to go to emergency. So having a plan in place at home is key. You may have your puffers, your medications. You may escalate different doses. You may have an add-on therapy and prednisone and/or antibiotics, which was also talked about. And then what to do after 2 days, you see no change in symptoms or you're getting worse. Seeking further medical attention or going to emergency. The main components of any respiratory rehab program are, for exercise, cardiovascular aerobic, weights and resistance, and stretching. And we're going to talk about each one. So the cardiovascular aerobic, any exercise or activity that will increase your heart rate. Walking, swimming, running, cycling. Physical conditioning that exercises your heart, your lungs, and your associated blood vessels. The Canadian Physical Activity Guidelines, so over 18 years of age, recommends 150 minutes of moderate to vigorous intensity aerobic exercise per week. And you can do this in smaller bouts, 10 minutes, 20 minutes, whatever works for you. And you want a moderate intensity, like a brisk walk, ideally over 3 to 5 days per week. And you want to get your Borg, shortness of breath scale, 4 to 6. What the Borg is, here's our Borg. It's a rating of perceived exertion. It's a way of measuring physical activity, your intensity, your level. It's how hard you feel you are working. So the Borg goes from 0 all the way to 10. And there's a couple of different versions. One goes from 0 to 5. 0 is no shortness of breath at all the way to 10, you're maximal. You're very, very short of breath. When you're doing cardiovascular exercise, we want to get you someplace between 4 to 7, so somewhat severe to severe, right? It represents how hard you feel you are working. It's very subjective. In the rehab program, I walk up to somebody, say on the treadmill, and I'll talk to them. And if they can talk to me in full sentences and tell me their life story, I'm increasing their resistance. I know they can work harder. I can get their Borg up a bit higher. I have fun with that.
Never talk to Stacey when you're on the treadmill.
And they learn that quickly, too. They do. So with severe lung disease, continuous exercise, cardiovascular exercise, may not be the best option. You may experience severe shortness of breath, lower extremity leg fatigue. You might have anxiety because you're scared of becoming short of breath, and therefore interval training may be a better option. So interval training is exercise involving higher intensity sessions with lower intensity sessions. You might start with 30 seconds of work, higher intensity, 30 seconds of rest, and working your way up to more of a lengthy period of time of exercise. And it's often better tolerated due to less shortness of breath versus continuous exercise, which is exercise involving continuous exertion energy over a longer period of time. And the research does show that there's no one better than the other. It's what works for you. Here are some examples of aerobic exercise. This is in the Maple Ridge program where I work. I took these pictures last week. There's a couple of ladies on the recumbent bike. There's Lois in the middle. We have around the perimeter a track. It's 50 meters. We've measured it out. And they work on increasing the number of laps they do over time. And there's a couple of men on the, looking so happy on the treadmills. So weight training. Just as cardiovascular or endurance training helps the heart and lungs, it's important to use resistance or strength training to build up your muscles. Strong muscles contribute to a more efficient body. So the kind of physical activity in which people lift or push heavy weights with their arms and legs to strengthen their muscles, to improve muscular strength, your power, your endurance, and your mass. The Canada Physical Activity Guidelines recommends adding muscle and bone strengthening activities using major muscle groups at least 2 days per week. You can try to put in a day of rest in between some of these sessions to help with muscle recovery. A session is made up of 1 to 3 sets of 8 to 12 reps of the same exercise. So a repetition or a rep is repeating that same movement over and over again, and a set is grouping of those repetitions. And always taking 20 to 30 seconds to rest and catch your breath after each set. Resistance training. So the 2 for 2 principle, did it change yet? Or overload principle is how much should I be doing? So for example, if you were finding it easy and you're able to complete 1 to 2 additional repetitions for 2 consecutive training sessions at the current weight you are using, you may consider increasing the amount of either the weight you're using, the resistance, the number of reps, or the sets. On the reverse side, if you're having a hard time to complete the goal you have selected, you may consider decreasing the weight or the reps or sets you were using. Joanne talked about breathing, exhaling on exertion, inhale on recovery. That helps keep the heart rate and blood pressure down, helps with recovery so you can perform the next lift. It can be the most difficult part of your resistance training, is getting that breathing down pat. And then your elastic tubing TheraBands. Tubing has been shown to have greater improvement in functional exercise capacity in the research. It has similar benefits to the regular traditional resistance things we think about, such as weights or kettlebells. The TheraBand tubings, they're easy to use, they're not expensive, and you can travel with them. They fold up really small. And here's a few pictures of some guys and gals doing weights in the program. They do have a lot of fun. They don't look like it there, but. Stretching. So Canada's physical activity plan recommends stretching 4 to 7 days per week. So it is safe to stretch every day. We should be stretching every day. Stretching helps you move easily, keeps your muscles relaxed and joints mobile. Regular stretching can help you live longer, better, and an improved quality of life, and maintain your independence, which is so important. Some examples of stretching, there's senior centers have stretching classes, Tai Chi, yoga, stretching slowly and smoothly without bouncing, using gentle continuous movement and hold for 10 to 30 seconds and repeating a couple of times. And the goal is for the stretch to be relaxed. You don't want to feel pain. And you have to remember to breathe. Don't hold your breath. That's the biggest one. Outcomes. How well is the program working? We use the 6-minute walk test. That's pretty standard. The test is performed by walking clients around a pre-measured flat surface for 6 minutes. I do it at the beginning of the program. I do a 10-week program, and at the end. And it's very rare that someone does not improve. Sit to stands, tests performed to measure how many times a client is able to move from a sitting to standing position in a predetermined amount of time. And the CAT, the COPD assessment test or tool. We use the CAT. It's a written test on impact of respiratory disease on quality of life. We like it because it's simple. It's 8 questions. I do it before and after as well. And the St. George Respiratory Questionnaire, kind of the gold standard for outcome measurements. We don't use it right now. It's long. It's 50 items. 3 domains of the St. George's. There's symptoms, activity, and psychosocial. So a day in the life of pulmonary rehab at Ridge Meadows Hospital. So typically, a lot of my guys come in early, 45 minutes early. They like to come in, they like to socialize. This is a big part of their life. The ones that come in early, I put to work. They have to get the water, they fill up the oxygen tanks. Then we all gather together and we stretch. Everyone stretches together as a group. And after that, everybody goes off and does the cardio, and it's at their own pace. Everyone's at a different space with their lung disease, different levels, and everyone's monitored close, but it's at their own pace. And then we gather together again as a group and we do weights. Wednesday is our education day. I rotate through all the different topics, lectures, and we do have fun. Here's some fun pictures. That was Christmas last year. Carol's going to recognize a few of these folks. They're post-transplant. There's a couple pre-transplant in here. And Hal on the right, that was his birthday last week. He turned 88. So one of the guys, he made sure everybody knew. And so one of the guys brought a cake in. And back to Joanne.
So once everybody's been through respiratory rehab and they're feeling really great, there's a transition point where you go back to your community. So we tend to see them. Every community is going to have different resources. Not every city has a respiratory rehab, and they can't go see, everybody just can't make it into Maple Ridge to see Stacey. So we look at people who are living sort of further out, and places to look are rec centers. If you go to most of the rec centers, you're going to have a variety of more exercise, aerobic-based things. You can go to the gym. There's light aerobics, there's seated aerobics, there's interval trainings. If they have a yoga room, there's light, which is the more hatha kind of yoga, which is more stretching. Then there's the more intense yoga, which is Ashtanga or Bikram. If you're not prepared, maybe just don't go for first time to a Bikram class, because I was a disaster. It's really hard, and it was not good. Anyway, so just make sure you're, kind of what you're getting in. You can read say light, moderate, intense. Tai Chi is fabulous. We have a huge community in Burnaby that they meet in Central Park. Doesn't matter. They're always doing Tai Chi 3 days a week. So they've kind of built their own little communities too. Find friends that will come and do things with you. Weight rooms are great. And if there are financial constraints with that, because sometimes it's quite expensive to go to the rec centers, every single city I've found going the Lower Mainland has a program that they can get a form, and then your recreation pass is subsidized. And I have a lot of my clients that I've done it for, and they don't even have to pay to use the rec center. So something to keep in mind if something's too expensive. Fraser Health has actually done a sort of a joint venture with OsteoFit. OsteoFit was based out of BC Women's Hospital to keep our women's bones strong as we age, and falls prevention and stuff. So they've come up with a program called Get Up and Go. So Fraser Health kind of partially subsidizes it across Burnaby to Boston Bar sort of idea. And so that sort of exercises, weight training, a lot of stretching. So it has all those components to make sure the exercise is maintained once you've worked so hard at rehab to get up to that state. Community centers have all sorts of different things, like the OsteoFit went up the hill for me in Coquitlam. There's a whole bunch of people who go walking. And it doesn't matter if you're in the front group or the back group or the middle group. It doesn't really matter where you're at. The fact, again, like we're saying, it's just getting out there. Just doing the distance, putting on the steps. People have step counters on their watch, on their Fitbits, all these other things. How many steps did you do? I'm taking the stairs to get 10 more steps. It is really, really important. The technology is catching up to us, but all these things are really important. We need to keep moving. Senior centers are great places too. There's private gyms, personal training. And another thing, no matter where you are in the province of BC at least, is that we have HealthLink. So 811, or you can do healthlink.ca. 811 is an amazing resource. You call 811 on your phone. Don't misdial 911, 811. And you tell them where you live, and they will tell you all the resources that are available for you at the rec centers and this and that, and they'll hook you up to your specific community. So in that, here's some online resources. So I guess this will be available online. But Healthy Families BC, that's all the guidelines for BC. Living Well with COPD, we rely heavily on that. Most of our program and all our programs actually across Fraser Health. Alpha One Canada, and then again, Lung Association, BC Lung, BC Women's Hospital again, and that HealthLink BC is such a good resource. You can just click on it, and then it'll take you to your community, or call 811. So if you're not computer savvy. So with that, if we have any questions. Thanks.
Thank you, Stacey. Thank you, Joanne. I would welcome you all to who have questions to approach our presenters today, meet our friends with AlphaNet and the Rare Disease Foundation who are in the hallway. We're going to take a break until about 5:15, and then we will continue with the remainder of our event. Thank you very much, and we'll see you back here at 5:15. Thanks.